We'll be starting with the discussion of GT4, and I hope after the live classes, you all are very much acquainted to be able to solve these questions. The idea is to cover all the possible questions, so let's go ahead with it without spending further time, okay? So, the death due to oral carcinoma in a mid-ear population is measured by, okay. So let's see with what they have given us. So they have given one is oral carcinoma, that is a specific cause, okay? And the time limit or the denominator here is mid-ear population, right? So now why it can't be, let's go by option wise, okay? What is crude death rate, okay? So when we talk about crude death rate, okay? So by crude death rate, what do we understand? These are the number of, okay, crude death rate is the number of deaths due to, okay, crude death is due to all causes, okay, due to all causes per thousand, okay, estimated in the mid-year. So apart from solving this MCQ, it is important that you know the definitions and write down these definitions so that you are able to solve any other question that comes by, right? So per thousand estimated mid-year population, okay, this is mid-year population in 1 year at a given place, okay. Now, if we talk about the question here, okay, so now here we have a mid-year population, which is the denominator, okay, so that is common here, all right, but here the cause is oral carcinoma, okay, but what do we have in our question? Due to all causes, okay, so it will not be crude death rate, okay, our answer. Then what is case fatality rate? If we speak about, say, case fatality rate, that is one of the questions here, okay. So by case fatality rate, we understand is it is basically the ratio of deaths, okay, this is the ratio of deaths, okay, so total number of deaths due to the cases, okay, so the ratio of deaths to cases is the case fatality rate, okay. Now this is mainly useful for acute infectious diseases, okay, this is useful for acute infectious diseases, okay. Its usefulness in chronic diseases is variable, okay, because the period from the onset to the death, okay, in case of chronic diseases is long, okay. So the formula of case fatality rate is the total number of deaths, okay, it is the total number of deaths, okay, due to a particular disease, okay, due to a particular disease, okay, upon the total number of cases due to the same disease, okay. So here we don't have a mid-year population in the denominator, okay, and here what we are calculating is this is the ratio, okay, so this is the number of deaths, okay, to the cases, all right. So we do not have the mid-year population in this. In what is asked is that in the denominator you have the mid-year population, whereas in case fatality is for that particular reason. Suppose for example for oral carcinoma, the ratio of deaths to the number of cases, okay. So then again, especially for chronic infections, it is not useful and it can't be case fatality because the denominator again is different, all right. The next, so also then there is something called as proportional mortality rate, okay. So here we are discussing about mortality rate, okay. So what is the definition of proportional mortality rate, okay? What do we understand by proportional? Let me write here maybe, okay. So yeah, so what is proportional mortality rate? Why it can't be any other reason, okay. So proportional mortality rate is basically the number of deaths from the specific disease, okay, it is the proportion. So basically number of deaths, okay, from the specific disease, okay, in a year. Okay, so from a particular year, the number of deaths, okay, divided by the total deaths, okay, divided by the total deaths from all causes, okay, all causes in that year, okay, into 100, okay, which they have not asked. Okay, so basically here what they have asked in the denominator is, although the numerator says that the death due to the specific disease, but the denominator says that the death due to all causes, okay, in that year, so which they have not asked in the question. Okay, what they have asked is the number of deaths in the mid-year population. All right, the number of deaths in the mid-year population. Okay, so basically this is what they have asked. Then we come to the cause specific death rate. That is also one of the questions. Okay, yeah, so let's go to cause specific death rate. Okay, cause specific death rate. Okay, so in cause specific death rate, what we have is that the number of deaths from a particular cause. Okay, number of deaths. Okay, so number of deaths that you have from a particular cause. Okay, from a particular cause. So this is like due to one particular cause, the number of deaths divided by the mid-year population. Okay, the mid-year population, okay, in 2000. Okay, so basically the answer here will be the cause specific death rate. Why cause specific death rate? Because the numerator says that the number of deaths from a particular cause, one thing, divided by the mid-year population in 2000. Okay, that is cause specific death rate. Okay, now there is also this option which is mortality rate. So basically all of these above are mortality rates. Okay, all the death rates, they come under the major heading of the mortality rate or the death rate. Okay, but the best answer here which we will have of all the options is the cause specific death rate. Understood? Okay, so the now the next question is, all of the following explain fluoride varnish mechanism except. Okay, so here what will be the answer? Okay, now what is the mechanism of fluoride? Let's go to the mechanism. Okay, so the mechanism by which a fluoride acts, okay, one is that it increases the enamel resistance. Okay, it increases the resistance in the enamel. Okay, it increases in enamel resistance, or it reduces the enamel solubility. So the basically enamel becomes resistant to the acid attack, to the bacterial attack. Okay, so this is one of the mechanisms of fluoride. The second mechanism is that it increases the rate of post eruptive maturation. Okay, so after the eruption, okay, the rate at which the eruption is taking place, okay, that rate, it is increasing. Okay, it increases the rate of the post eruptive maturation. Okay, and one of the major qualities of fluoride is that what we know, what happens in dental caries, there is loss of minerals, right? There is demineralization. Okay, but fluoride has the capability in it that these days we study a lot on the remineralizing agents, right? So fluoride has the ability to remineralize the incipient lesions. Okay, also what the fluoride does is that it interferes. Okay, it interferes with the plaque microorganisms. Okay, the microorganisms which are related to formation of plaque. Okay, also it modifies. Okay, it leads to modification in tooth morphology. Okay, so now let's go back to the options which have been given. Okay, it is alters tooth morphology permanently. No. Fluoride cannot completely or permanently, alter the morphology of the tooth. Yes, it directly acts on the bacteria. Yes, it remineralizes the initial caries. Yes, it inhibits with the functioning of the microorganisms by inhibiting the bacterial polysaccharide secretion. Okay, so this is definitely one of the mechanisms. All the other three are the mechanisms of the fluoride varnish, but it does not completely or permanently alter the tooth morphology. Okay, now coming to the next question, which is, which of the following is not a measure of dispersion? So is range a measure of dispersion? Yes. Okay. Is mean deviation a measure of dispersion? Yes. Is standard error a measure of dispersion? No. Is standard deviation a measure of dispersion? Yes. So now what are the measures of dispersion? Okay. There are several measures, okay, of variation, or variation is also called as dispersion. Okay, and the technical term of variation is dispersion. Okay, and what are those measures? Those measures are range. Okay, variance is also one of the measure of that. Okay, and standard deviation is the measure of that. Okay, and confidence interval. Okay, so confidence interval is also one of the measures of dispersion. Okay, so now basically, yeah, so now these are the other options. Okay, now about the range. Okay, range is known as, I'll give you some more tips on this. Okay, so basically range is known as the simplest measure. When you get a question that which is the simplest measure of dispersion, you would say it is the range. Okay, range is the difference between the highest and the lowest. Okay, that is the range. Okay, now the average, the deviation. Okay, so the deviation or the mean. Okay, the mean or the average deviation, which is the second option. Okay, so now it is the average of the deviations from the arithmetic mean. Okay, so basically when we take the average of, like, we take the difference of from the mean of all the observations. Okay, and then we take the average of all those observations, that is the mean or the average deviation. What is variation or dispersion? That this is the distribution of the values about the mean. How much, are they varying around the mean? Okay, so mean or average deviation is that what is the average, okay, of the deviations from the mean. Okay, that is the mean or the average deviation. Okay, now what do we understand by standard deviation? Now standard deviation is the most common measure of assessment. Okay, if we talk about range, it is the simplest, and standard deviation is the most common. Okay, so whenever they ask you which is the most common measure, then it will be standard deviation. Okay, now what is the difference here? We clicked between, we said that the answer is standard error. So what do we understand by standard error versus standard deviation? Okay, standard error versus standard deviation. Okay, so now both, okay, the standard error, all right, and the standard deviations, both are the measures of variability. Okay, like how much variation is there, but the standard deviation measures variability within a single sample. Okay, and the standard error estimates the variability across the multiple samples. Okay, this is across the multiple samples. This is what do we understand by standard error. Okay, now coming to the next question, which is, a study was conducted, okay, in a group of children which was at the age of 6 years, 8 years, 12 years, to clinically assess the dental caries. Okay, Now at these years, the children were assessed for the sugar feeding habits. Okay, so what were those sugar feeding habits at the age of 8 years, 10 years, and 14 years? Okay, so basically they had seen the frequency of intake, education of the mother, income of the family members, and the feeding habit. Okay, they were taken into account and they wanted to see the relationship between the dental caries and sugar feeding habit. So what is the study design in this? Okay, so the answer is definitely cohort study. Why cohort study? Because with the description which is given in the question, logically it should be cohort study. Why? Because the same group of people, that is children at the age of 6, 8, 12, they are being continuously followed. Okay, so the same group is basically followed for a long period of time. Okay, and they are trying to find the causal relationship. Okay, so in causal relationship we try to find in the cohort study we try to go from the cause to the effect. Okay, they are assessing that how much sugar is being fed, what are the various causes, and eventually whether they develop caries or not. Okay, so in them the sugar feeding habits were children were assessed for the sugar feeding habits. Okay, and also the various parameters. Okay, so this is basically a cohort study. What is a birth parallel study? Now in birth parallel study, this is a parallel group trial design. Okay, now in this what happens that this is the most commonly used study design. Okay, so what they do in this design is that subjects are randomized to one or more study arms. Okay, and each arm will be allocated a different intervention. Okay, so there are different arms, like some subjects are in one arm, some subjects are in other. For example, if this was a birth parallel study, maybe one arm they had assessed for frequency of intake, other arm for the education. Okay, so birth parallel study is the study in which each arm is studied for a different pattern. Understood? So now the next is birth crossover study. Now crossover study is also called as a crossover trial. Okay, this is a longitudinal study. Okay, where the subjects receive a sequence. Okay, so all the subjects are given different treatments or the different exposure. Okay, so what can be, while crossover studies can be observational studies, but many important crossover studies are controlled experiments. Okay, so what happens is that basically one subject is given one kind of treatment, then the other subject is given other treatment, and then they are interchanged amongst each other. Okay, case control study, we already know what case control study is. Okay, so the next is, what is the function of the WHO collaborating center? Okay, so it is here we are not studying the functions of WHO. Okay, we are studying the functions of the WHO collaborating center. So here the answer would be A. Okay, because these are the centers. What are these centers? Basically the WHO collaborating centers, as the name suggests. Okay, the other name for this is WHO CC. Okay, so this is basically an institution. Okay, this is an institution. Okay, who form a part of. Okay, so these centers basically a part of an international collaborative network. Okay, these are the institutions which are a part of an international collaborative network. Okay, these are a form of an international collaborative network who carry out, what these centers do is that they carry out activities. Okay, they carry out the various activities in support of, those activities are carried out in support of the organization's program. Okay, in organizations program at all levels. Okay, so what these centers do is that as a part of the WHO, they carry out various activities. Okay, to support the program at the various levels. Okay, so what these centers do is that they carry out the work of the WHO by collecting the information, by disseminating, by collaborating with the information. So all of this is being conducted by the WHO collaborating center. Okay. What is the mean score of CD4 counts of people with HIV on basis of this diagram? Okay. So through this image, and the numbers can be different in the exam, but we are sure of the answer because this is a direct repeat from the previous medical papers, this question. Okay. So the answer is less than 350, but I will also explain how this answer came in. Okay. So now basically this is the formula that we used, which is mean. To calculate the mean, the formula is summation of fx, okay, divided by summation of f. Okay. F means the number of people, okay, and x means the mid point. Okay. So in this, what did we do? Okay, where here what we summed all the observations. So here we would have, say, 50 into, okay, the midpoint here is 50. Okay, 50 into what is the observation, what is the midpoint, it is 5. Okay, plus we added here what is the midpoint, 150. Okay, and here what is the frequency, into 20. Okay, plus here what is the midpoint, it is 250. Okay, and here it is 250 into 30. Okay, plus 350. Okay, so this will be 350 into 35. Okay, then you have 450. So it is 450 into, here we have 450 into 10. Okay, then we have 550. So it is 550 into 5. Okay, that is the here 550 here into 5. Okay, so this is 550 into 5. Okay, divided by the total observations. So the total f will be how much? It will be 105. So what we'll have is 30250 divided by 105. This will make it 288.09. So the total is less than 350. So the answer is definitely B. Okay, now here mean. Okay, what do we understand by mean? Mean is the simplest when we talk about the measure of central tendency. Okay, so mean is the simplest measure. Okay, when we speak about it, mean is the simplest measure of central tendency. Central tendency is where we are seeing that around the center point. Okay, that is mean. Okay, so it is obtained by adding the individual observations and dividing it by the total number of observations. Okay, so mean is normally calculated with the formula of sum of this divided by the number of observations. Understood? Okay, now 7. Okay, so now here this is a misprint. Okay, so here what we want to say is that, okay, this is a misprint. What we want to tell is that, how many SDs are there in the area which covers 99.7% of the values. I think I have discussed this question with you all in the query a lot of times. So I know by now you understand that what is the misprint here. Okay, so this is basically your normal curve. Okay, around a normal curve, this is your this is the mean. Okay, now around the first curve, what happens is that, where you say mean plus minus 1 standard deviation. Okay, so in mean plus minus 1 standard deviation, this will cover 68.3% of the surface area. Okay, next we go into mean plus minus 2 standard deviations. Okay, so this area is mean plus minus 2 standard deviations. How many findings will it cover? 95.4%. Okay, next we cover the mean plus minus 3 standard deviations. Okay, so this will be mean plus minus 3 standard deviations. This entire area will be 99.7% variations. Okay, so basically the area between one standard deviation on the either side, where there is mean plus minus 1 standard deviation, this will be 68% approx. Okay, the area between two standard deviations on the either side will be 95%, and the area between 3 standard deviations will include 99.7%. Okay, so, and this is about, and what about the standard normal curve? So there are many normal curves. Okay, but there is only one standard normal curve. Okay, the standard normal curve is bell shaped. The curve is perfectly symmetrical, okay, on an infinitely large number of observations. And in a standard normal curve, the maximum number of observations is at the mean, and the number of observations gradually decrease on the either side, okay, with few observations at the extreme. In a standard normal curve, the total area of the curve is 1 and the mean is 0 and the standard deviation is 1, okay. And in a standard normal curve, all the three measures of the central tendency, that is where central tendencies where all the values lie around the midpoint, okay, so mean, median and mode all will coincide because there is no deviation, there is only one standard deviation, and the mean here is 0. So all three will be 0 and they three will coincide. That is about the standard normal curve, which is bell shaped, okay. Now coming to the eighth question, which is to study the incidence of caries in 10-year-olds in school, which is the best study design. So the answer here is A. Okay, why A? Because here we are talking what is the name of a cohort study. Okay, prospective study is also known as cohort. Okay, so cohort study is known by a variety of names. One of that is a prospective study. Okay, one is cohort study. Then it is also known as a longitudinal study. Okay, it is also known as incidence study, and it is also known as forward looking. Okay, it is forward looking study. Okay, so now the distinguishing feature of cohort study is that here we identify the cohorts prior. Okay, before the disease occurs, we identify the cohort. Okay, then the study groups, okay, they are observed over a period of time to determine the frequency of disease amongst them. Okay, and then the study proceeds from cause till the effect. This is how the study proceeds. Okay, next question we have is, which of these is a non-parametric test? Okay, which of these is a non-parametric test? So here the non-parametric test would be the Mann-Whitney test. Okay, why a Mann-Whitney test? Because Mann-Whitney test is basically Mann-Whitney, the full name here is Mann-Whitney U test. Okay, this is basically a non-parametric test which is used to compare. What we do in this is that we compare the medians, okay, the central points of two independent samples. Okay, please remember this about the Mann-Whitney U test, that one, it is a non-parametric test. Okay, other thing is that it is comparing the medians of two independent samples. Okay, and it is basically okay, so what about the other options, which is what is a Pearson's correlation analysis? Now, as I had explained, the Pearson's correlation coefficient, okay, what is that denoted by? It is denoted by a small r. Okay, this is the most common way of measuring a linear correlation. Okay, this is a common way of measuring the linear correlation. Okay, now what happens is that this is a number, it lies between -1 to +1. Okay, this measures the strength. Okay, and what is the direction? Okay, it measures the strength and direction of the relationship. Okay, whatever is the direction and relationship between the two groups, okay, between the two variables. Okay, that is what is correlation coefficient. What is student's t-test? Student's t-test is a statistical test. Okay, so it is a test to test whether the difference between the response of two groups is statistically significant or not. Okay, what is a odds ratio? Odds ratio is a statistic that quantifies the strength of the association. Okay, so this is basically it quantifies how much the two events are related. Okay, the strength of the association is with the odds ratio. Okay, now which are the 5 Ds which are useful in counseling a patient to stop the urge for smoking? Okay, so the 5 Ds which help you quit tobacco, okay, they are drink. First is drink water. Okay, then discuss with the people, gain support for yourself, deep breathe, okay, that always helps when a person suddenly feels the urge to smoke, okay. Delay it, because the dopamine hit or the urge is only for a few seconds. So if you delay it, the urge dies down, okay. And then distract, which also serves the whole purpose, okay. So in this, the option will be B, okay. It can't be doubt, because when it comes to tobacco cessation, there is no role of doubt of any dose or anything like a declare, okay. The patient is convinced basically to quit tobacco anyhow, okay. Coming to the next one, while classifying pain according to severity, which of the following is used? So here the answer will be C. Why? Because when we classify pain, it is mild, moderate and severe, okay. So the ordinal scale is the classification involving numbers, okay, but there is no true mathematical relationship between the two, okay. And the alphanumeric is an adjective that means consisting of both letters as well as numbers, or being in a character, okay. That is what do we understand by alphanumeric, okay. Now coming to the next one, which is in silver modified atraumatic restorative technique, which is the SMART, okay. The silver particles, which are the silver particles that you use? So basically in the SMART technique, the silver particles that we use is silver diamine fluoride, okay. So silver diamine fluoride, it contains approximately 24 to 28% silver, okay. This contains how much? 24 to 48% silver is there in it, okay. And it has 5 to 6% of the fluoride, okay. So basically silver diamine fluoride should not be used in patients who have an allergy to silver, okay. Now the main disadvantage of the silver diamine fluoride is the aesthetic result, okay. That is what happens in this is that it permanently blackens the enamel, okay, and dentinal caries lesions and creates a temporary henna appearing tattoo, like if it's allowed to come in contact with the skin. Also the skin lesions that it causes, they last for like around 14 days. So this is the disadvantage, okay. Now the other question is the new caries prevention method, okay, which are ART, papillary, chemico-mechanical methods. What are they? What technique is it? So this technique would be the minimal invasive technique, okay. So now the new techniques of caries prevention, which is ART, papillary, okay, like what are the minimal invasive techniques, which is ART, okay, papillary, okay, chemico-mechanical caries removal, okay, and silver diamine fluoride, okay. Now all these are based on caries prevention, okay, and elimination with involvement of minimal invasion to the tooth structure, okay. So what these techniques do is they affect the tooth in the minimal invasive method, okay. They do not like the aim is to cut as less dentine as possible, okay, to cause minimal damage to the tooth structure, okay, and then to restore it. So the concept here is minimal invasive technique, okay. Now all others like incipient caries management, deep caries management, or the detection they are not a minimal invasive technique, okay. Next is the toothbrush efficiency score in a small sample of population is analyzed by, okay. Here the answer will be t-test, okay. Why? Because t-test is a test for quantitative assessment, okay. This is when the sample size is small. So when you want to do a quantitative, here we are not measuring, so the population is small and we are doing a quantitative assessment, okay. So now this paired t-test is also known as student t-test, okay. It is used for quantitative data, okay. That is what is a quantitative data? The data has a magnitude and is normally distributed in the population, that is the data is continuous, okay. Now each individual has one measurement from a continuous spectrum or range. Okay, what could be the continuous data? Suppose a height, okay, body temperature, the blood pressure of a person, the height of a person, all this is what? Continuous data. So toothbrush efficiency score is a continuous data. Okay, so now student t-test is of three types. Okay, so basically student t-test is for a single small sample, that is one type. Then there is for independent samples, which is also known as unpaired test. For the independent sample, for paired sample. Okay, so for paired test it is known as student's t-test is paired test. Okay, so paired t-test is it compares the means of two paired samples when two readings are taken from the same group. Okay, so in this what they must have done is that from the same group they would have taken the initial scores, and after the toothbrushing they would have taken the scores again from the same group of people, so it would have been the paired t-test. Okay, now why it can't be chi-square test? What the chi-square test does is it tests the distribution and relationship of the categorical data. Okay, the data has to be categorical. Okay, now Pearson's correlation coefficient is the most common way of measuring a linear correlation. So when you want to study the linear correlation between two variables, okay, that is when you use a Pearson's correlation coefficient. Okay, now what is ANOVA used? ANOVA is a collection of statistical models, okay, and their associated estimated procedures, okay, such as variation. So when you want to study the variation between the groups, okay, that is, and to study the difference between the means, okay, that is when the test that you use is ANOVA. Okay, that is that with that I think we complete our GT discussion, okay, for all the questions. I hope the other concepts are also clear to you. Okay, so what did you so this study designs, I hope these are also very clear to you. Okay, yeah. So what is basically a retrospective study? Okay, the retrospective study is also known as there is something called as a retrospective case control study, which is they are a common first approach, but what are they used for? For testing the causal hypothesis. Okay, so that is recently the case control studies are a permanent method in epidemiological investigation. Okay, coming to the next one, which is a cross-sectional study. So the cross-sectional study is the simplest form of an observational study. Okay, what we do in a cross-sectional study is we do only the examination once. Like one time you go to a classroom, you study their dental caries status or what are their habits. Okay, so this is done at one point in time. Okay, the results of which can be projected on the whole population provided the sampling has been done correctly. Okay, now what is a crossover study? Crossover studies are trials in which participants they receive multiple interventions. Okay, on the same individuals multiple times they are getting the intervention. Okay, and on the same individual they are checking the effect of each intervention. Okay, understood? So I think now the concepts are clear, and this is all about the GT discussion. Thank you.